Welcome to Motors and Medicine. On today's episode, I'm going to be discussing elbow pain. So I know a lot of you out there suffer from elbow pain. In particular, I'm going to be covering tennis elbow and golfer's elbow. We'll first start with tennis elbow. That's like the common name that everybody refers to it as. Tennis elbow or lateral epicondylitis pertains to inflammation of the attachment site on this part of your elbow where your dorsal forearm musculature attaches. Okay, that's the lateral epicondyle. So if you have lateral epicondylitis or tennis elbow, that attachment site is inflamed. Now, how can that become inflamed? Well, the typical causes are, number one, overuse. It was named tennis elbow because of the repetitive backhand motions. The second is direct blunt trauma right to the epicondyle. And the third is ergonomically how we do things, how we grasp, how we use tools, screwdrivers, how we open jars, things like that. So the ergonomic thing. Now, the opposite side of the elbow, the medial epicondyle, basically the same condition, or golfer's elbow. We call this medial epicondylitis in clinic, but golfer's elbow will work fine. It actually serves as the medial attachment site for all of the forearm musculature on the inside. And so where all this attaches down here onto this bony prominence, we also suffer from the same thing as the lateral side, from overuse, from direct blunt traumas, or the way that we do things, the ergonomics of our daily activities, grasping and turning a screwdriver, turning a doorknob, things like that. So if you do a lot of repetitive work, or you've had an injury to those points on the elbow, eventually you're going to be suffering from epicondylitis on either side. Now, this condition is extremely troublesome and hard to treat. I have suffered from both lateral and medial epicondylitis over many years, from both direct blunt traumas to overuse, from weightlifting to grasping too hard with certain activities like opening jars and just doing things repetitively in the shop, in the garage, whatever it is. Turning a wrench, that kind of stuff gets annoying after a while. I'm prone to it because some people are more prone than others. Some people have a much higher propensity for developing lateral and medial epicondylitis than other people. If you happen to be one of those people that suffers from this condition, there are things that can be done to help manage the symptoms. Now, in the past, I've talked about using ice massage for conditions like this. And in this particular condition, because it's a bony prominence and it's very superficial, an ice massage works really well. So if you take a Dixie cup, freeze it, fill it up about 3/4 of the way, freeze it solid, tear off some of the top, and then just plop it right down on this epicondyle or on the inside, and you're going to rub in concentric circles for about 5 to 10 minutes. That helps alleviate the symptoms from epicondylitis. The second thing that can be done that's helpful is doing what's called a gradually progressive friction massage. So you start at that point and you kind of massage downward in a spiral fashion along the muscle that's attached to this epicondyle site. Okay, same thing on the inside. You start at that point and kind of massage outward from it. And this kind of helps increase circulation to the site to help promote a healing response. Now, this progressive friction massage, you don't want to push too hard, but you also don't want to push too little. You push too hard and you're going to create more inflammation. You push too little and it's really not going to help a whole lot. So you're going to have to find like a happy medium between the two. In my case, since I suffer from both, I actually pinch both the lateral and medial epicondyle, and I will kind of do a concentric friction on both sides And that seems to help alleviate the symptoms whenever I start to have them. The third thing that helps quite a bit is using some type of concentric band. In this case, this band here, it can be acquired pretty much most places. This one's called the Bandit, and you just basically put it around the forearm, lock it around the muscles of the forearm, and what it will do is apply pressure to those muscles that are pulling at their lines of origin on those bony prominences. And by applying just a little bit of pressure, not too much that you're compressing the muscle to where you're cutting off circulation or anything like that, but just enough pressure that when the muscle contracts, it's not contracting so hard that it pulls repeatedly at that origin site, and it won't cause as much inflammation. So using a band like this works great when you're doing a whole lot of heavy lifting or repetitive activities. And then the last thing is just trying to figure out the ergonomics of how you do things. So figuring out what activity am I doing and what am I doing that's causing this to get inflamed. Sometimes it can be something as simple as how we grasp things, how we turn doorknobs, how we open jars, things like that. We have to try to modify the ergonomics of how we do things if we happen to suffer from this condition. Because if you don't, it's just going to become more and more perpetual. In my case, I've actually had to endure multiple cortisone injections as well as PRP or platelet-rich plasma injections to both sides, which helped temporarily and actually alleviated the symptoms on a temporary basis. But in my case, my condition keeps recurring because of how I do things, because I still lift weights, I still do chin-ups, I still, wrench on cars. Things that aggravate still tend to cause inflammation in these two sites. So my case is pinching it, doing the concentric massage, doing ice massage, using the band, trying to alternate how I grasp so that I'm not maybe doing too much with one hand, maybe switch and do the other. And then, of course, I take an anti-inflammatory, ibuprofen, naproxen, any one of those will help as well. If you're focused on doing these things, you'll greatly reduce the incidence of this condition and how often it gets inflamed. But there's a caveat with that. If you suffer from this condition, even if you've had injections done to it, it can recur and it will recur depending on how you do things. So the key here is just to try to alter how you do things as much as possible. Alter one hand versus the other when you're doing certain activities, and avoid overuse as much as possible. This condition is so debilitating, it can get to the point where you can't even pick up a glass of water, comb your hair, brush your teeth without pain. Certainly, to say nothing about being able to lift weights or lift something heavy. That will just pretty much fall out of your hands if you try that when you've got a very inflamed epicondyle on either side. And unfortunately, a lot of people suffer from this condition to the point where injections just are temporary fixes, and ultimately they end up having to require a surgery where the surgery itself is not super efficacious either. The surgery consists of cutting this tissue open and just literally removing some of the chronically degenerative inflamed tissue and hoping that the new tissue that grows in will be less likely to get inflamed. That's the problem, is that this condition is so perpetual and so chronic in nature, it can be very debilitating for a lot of people. So the takeaways here, do the concentric medium pressure massage, the ice massage, anti-inflammatories, wear a concentric band, try to alter how you do things, grasping and other things like that, and just try to avoid anything that's overuse. If you can keep those things in line, you'll mitigate a lot of the symptoms and minimize a lot of the heartache that you'll suffer from when you have this condition when it's at its worst. I manage mine to the point where I still get daily symptoms, and I'm still able to do the activities that I enjoy, like work on cars and do chin-ups and lift weights and such, without having this compromise. And that's because every day I have to do those concentric massages and ice massage and take anti-inflammatories. It's a process, but if you are vigilant and you treat it on a daily basis, you can prevent this from becoming a major issue. Hopefully this information was helpful. Hopefully you guys who do suffer from this condition have some tips now on how to manage it and how to manage it a little bit effectively. If you do get to that point where it's severe enough that you may need cortisone or PRP, those are helpful methods of treatment that have to be done in a doctor's office, but they are temporary and they will not last or endure indefinitely. This condition tends to come back, so just keep that in mind and try to focus on and be cognizant when you're going to do something that you may aggravate this, and so you need to try to figure out a way to modify how you do things and try to do all those other things that we talked about to alleviate the symptoms. So like always, please, if you like this content, hit the thumbs up button. Subscribe if you haven't. I appreciate the support. And next time we'll get back into the cars and we'll see what we work on. So like always, this is Motors and Medicine signing off. Have a great one.